I feel great. Thank you so much. All right, so I just want to give you guys a clear idea of what's going on here. A few weeks ago, I started getting some serious back pain. And then I went to see the first doctor, a Western-style doctor, and he said, this is, and I quote, "You must have surgery, there's no other way." And I was, I'm a strong guy actually, really tough, but I was sat in the lobby and I cried. For a few seconds at least. Because that's a terrifying idea to have surgery on your spine. He wanted to remove the herniated disc, the entire disc. That's what he wanted to do, not just part of it or some little piece. And so my wife and I, we went to another hospital, this hospital, which is a traditional Chinese medicine hospital here in Wuhan. And we saw a physical therapist and a doctor there in this hospital, and he prescribed us all kinds of physical therapy. He prescribed acupuncture therapy with electrolysis, I guess that's what it's called. It's electricity, plus these pads that pump electricity, plus light therapy, plus some massage therapy. And I don't know, maybe they were all helping. The only one that really helped me regain range and moving my head around was the physical therapy. And the disc is displaced back here. And we had an MRI at the Western hospital. But when we came to this hospital, they were also like, we need an MRI. We want to know what's going on. We finally, after a week of PT, of physical therapy, we moved up to the 5th floor and we saw another traditional Chinese doctor here, and he prescribed a series of medicine, Chinese traditional medicine, and did some acupuncture on me, and did a series of injections with some very modern medicine. And all the way up until I got to this therapist, I was like feeling hopeless and worried that I was going to have to end up having surgery. But here it is about 5 or 6 days after meeting this doctor at the traditional Chinese medicine hospital, and the problem has largely resolved itself. I'm like 98% healed. So like there's a little like slight discomfort, just barely, but like the pain that was running down my arms from the herniated disc pressing on my spine is gone. And the pain, the spasms are mostly gone. And I have a full range of motion looking around, up and down, left and right. He completely managed to heal me with one visit. For those people who haven't tried traditional Chinese medicine, give it a try, because you won't regret it. And if some Western doctor tells you you need surgery, there's a good chance you don't, and you might be able to just seek alternative therapies to resolve your problem. This is my MRI. It shows that I have broken a disc between two of my spinal columns, what my wife and I are calling a domino, which means a little thing sticking out, hitting the nerve and damaging me. I had to be in this MRI machine, which is really unpleasant. So you have documented me, or you've seen me. I've been going to traditional Chinese therapy, taking traditional Chinese medicine. I've had electrical shock therapy. I've had all kinds of different therapies to prevent me from having surgery, and I have been getting better. This is something called Mali Shu, and it is a traditional Chinese medicine that warms the muscles underneath and helps with the process of healing a muscle-related injury. In addition to the acupuncture and the moxibustion and the cupping therapy and massage therapy and all kinds of other different therapies to avoid having surgery, which I pretty much have gotten. I'm almost healed. I have also been using this drug called fluorbiprofen cataplasms, which goes on the area that needs to relax to prevent spasming. This is similar to ibuprofen, so it's not that powerful. It's not really a painkiller as much as it helps you in the recovery. And another thing that I'm using is this traditional Chinese medicine, and this is really effective. It comes out of this container, so I apply it by turning it around, and then some squeezes out onto this, and then it gets rubbed on my back. The good news about this is my doctor, my medical doctor that I've been seeing at the traditional medical hospital, who's also using Western medicine, he's injected me with steroids, with one time only. He says that my therapy's come along to the point where I will no longer need surgery. And my first doctor at a different hospital said surgery was the only way. So by using all of these traditional Chinese medicines, plus a couple of simple injections, I have healed myself. I have actually healed the herniated disc. And I will not need to have surgery to remove the herniated disc, which is what the original doctor said I would have to do. So give traditional Chinese medicine a shot. You know, try these tinctures, try acupuncture, try the molysure. If you have back problems, don't just let them start cutting you up. Don't cave to the fear. You really have to give therapy a try, because you might be surprised. And you know what? The doctor who said he wanted to have surgery said it was going to take at least 3 weeks before I could even start to walk. It's been 2 weeks of taking physical therapy and Chinese traditional therapies, Chinese traditional medicine, and I'm healed in 2 weeks. If I had had surgery, I wouldn't even be able to walk yet. Ooh, that feels really warm. The molysure feels really warm on my skin. It makes my muscles feel very relaxed. And I have to be very thankful to my wife, who's patiently applying all of these medicines to me every day. They're electrocuting me, and my wife is letting them. In fact, my wife is paying them to electrocute me. My only question is, what did I do so wrong for her to pay them to torture me? This is my third day of therapy, my third hospital, and they're using electricity and acupuncture to, I have no idea what they're doing, but they said they needed to do it, so here we are. For those of you who think this might be painful, I just want to say, yeah, it is. It's painful. I'm so sorry, Summer. I won't use this much of the bed anymore. I didn't realize you were so serious about it. I'll make sure that you have more space on the bed, and I'll stay to the side. You can have 2/3 and I can have 1/3. I'm so sorry. Tell them to stop. Traditional Chinese hospital in Hanyang, Wuhan. I'm going to get my prescription filled for Chinese traditional medicine. Can you help me?
You don't know how to take it?
They told me to give this to you.
I mean,
To drink it with this, make it hot.
Yeah, you use the hot water and
No problem. Thank you.
mix them with spoon or something.
Great.
In a glass and drink it morning and evening.
Great.
Twice a day.
Thank you.
Twice
Yes.
a
请
day.
杨令文到3号窗取药。
杨丽文。Okay, thank you. Thank you, sir.
So I think 14 days.
Thank you, sir.
Twice a week. Oh, twice a day.
Thank you, sir. So this is what my wife calls my dun dun. Each one of these is one dun. You put it in a cup with hot water and stir it, and then you dun. Drink it really fast. All traditional Chinese medicine from thousands of years of history. Well, I've switched to my fourth doctor, and this doctor is a medical doctor who specializes in mixing traditional Chinese medicine with Western medicine. And earlier today he gave me a bunch of Western medicine, shots with steroids and stuff. And this is my second round of traditional Chinese medicine, I guess, concoction talk. And my wife calls it dun dun because it sounds like dun 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 dun. She wants me to drink it. It's not bad. It doesn't taste bad, but you know, so it's part of my mixture of Chinese and scientific, like medicine mixed together. And here we go. It is my 6th day of drinking this. Hey, you know, I avoided surgery. It's been a few weeks since I last spoke on this topic. This video has taken a long time for us to do because we wanted to make sure that my neck stayed healed. And I'm not in agonizing, excruciating, terrible pain anymore, and I am free from the fear of surgery. There's a little stiffness, and I, you know, have to wear a neck brace here and there, but I'm doing a lot better. Now, for those of you who have a similar issue, maybe you will end up needing surgery. I don't know. But what I do know is this. You should try traditional Chinese medical therapy first. If you can avoid surgery, you should do that. It's not about the cost, it's about them opening up your back where your spine is exposed and there's people standing over you. Irreparable damage being done to your body. So if your doctor's saying you must have surgery, give traditional Chinese medicine a shot. Maybe, like me, you can avoid the knife. All right, we'll see you next time. Bye-bye.